Getting ready to reconvene our committee meeting. Let me take a roll of the committee participants to make sure that everyone's back from lunch. Albert Wong.
I'm here.
Jason Weiss.
Here.
And Jason, I know you have to drop off for a few minutes, at about 45 minutes. Just let us know when you come back on.
I will do so. I'll let you know when I leave too, Debbie.
Okay, thank you. Jig Patel. Cheryl Butler.
I'm here.
Sung Oh.
I'm here.
Going back to Jig Patel, can you unmute? Are you there?
I'm here. Thank you.
Okay, perfect. All right, so we are now starting up with agenda item 9, discussion and consideration of proposal to expand the authority for pharmacists to order and perform tests. As we've discussed and is in the meeting materials, the existing law establishes limited authority for pharmacists to perform routine patient assessment procedures, including routine drug therapy related patient assessment procedures. This meeting material detailed the existing provisions in the pharmacy law, as well as provisions related to pharmacist authority that reside in other areas of the business and profession codes, generally under the purview of the Department of Public Health's Laboratory Field Services. As previously discussed on August 25th, 2020, the DCA director issued an order that waives specified professional licensing requirements and amends the scope of practice of pharmacists and pharmacy technicians to allow them to perform waived point-of-care testing used to detect the SARS-CoV-2 virus. Along with the waiver, guidance was released to inform and educate pharmacies, pharmacists, and pharmacy technicians of the clinical laboratory requirements that apply under the DCA order. In previous discussions, the board approved a policy statement in support of expanding testing authority for pharmacists to include both COVID and influenza testing. This policy statement is in the meeting materials. So to expand it beyond, to make it statutory, so expand it beyond what we currently, what the waiver currently allows. Because without expanding it, the authority will go away once the pandemic ends. As you may recall, during a private discussion, stakeholders suggested that it might be appropriate to expand the testing authority beyond COVID and influenza. However, because of limitations in the agenda item, such discussions could not occur at that time at our previous meeting. To aid in the discussions today, several policy questions are provided in the meeting materials and will be displayed on the slide on the WebEx. I suggest that we consider each of the policy questions posed in the meeting materials, as I believe these questions could aid us in developing a recommendation for the board's consideration. So, members, my plan is to go through these policy statements, and what I'm going to probably do is maybe clump them somewhat together as it seems appropriate, and then open, have us kind of discuss it, and then we can open it up for public after we've. I think I'm going to try discussing all 7 of them, and then we'll open up for the public. So yeah, there we go. Thank you. So here's the policy considerations. I'm going to read all 7 of them first, and then I'll start pulling committee members for their comments. Should pharmacist authority expand to include CLIA-waived tests for all respiratory diseases? Should the pharmacist authority be expanded to include CLIA-waived tests for strep throat? Should the pharmacist authority be expanded to include other CLIA waive tests for sexually transmitted diseases? Are there other CLIA waive tests that should be considered as part of the pandemic preparedness? Are there other CLIA waive tests that should be considered to reduce the spread of disease? Should the testing authority be limited by certain types of specimen collection? And should the pharmacist authority for specimen collection be made permanent? I think that the intent of the last two questions are to consider that, the first 5 questions are focused on CLIA waive testing. The last 2 questions are to consider if there are other test types that we might want to take in consideration besides just CLIA waive tests. And if so, what kind of limitations or, what we're talking about. We tried to kind of open this up so that we didn't get into the same situation the last time that this discussion came up, where the item was agendized so narrowly that we could not go beyond discussing CLIA, COVID and influenza testing. So we've tried to open this up so that we're definitely discussing those 2 types of tests, but possibly other CLIA waive tests. And then, should there be other tests beyond just CLIA waive tests that we should consider? So let's kind of combine the first 2 items. Should the pharmacist authority be expanded to include CLIA waive tests for all respiratory disease? And then kind of the step beyond that would be for strep throat also. So those are fairly common CLIA waive tests that pharmacists are performing today, specifically in other states. So with that, I'll start with Albert, and let me know, what you think about CLIA waive tests for strep and respiratory disease.
I have no comment for now.
Okay. Jason, do you have any thoughts, comments?
No, none at this time, Debbie. Thank you.
Jude Patel.
Yeah, I think this is a great service to consumers in California, and we should consider expanding it.
Cheryl Butler.
I just have a question. Is this, as long as the clinical laboratory test and examination is performed under the overall operation and administration of a laboratory director, as described in 1209?
Anne, can you answer
Debbie,
that?
would you like me? Yeah,
Yes.
so this would not be, Cheryl, circumventing any of the requirements under laboratory field services. So should the board agree that this is appropriate for pharmacists, conforming changes would be made to laboratory field services.
Okay, so the operation, the administration of a laboratory director would also still be included in this? I'm not clear.
Yes, so under the board's current proposal, you still have a laboratory director, and the board's proposal allows the PIC to serve in that capacity.
Oh, okay. Okay. Okay, I'm clear. Thank you.
So Anne, can you just remind us which waive tests you currently allow?
So under the board's statutory proposal, it will allow for CLIA waived COVID-19 as well as CLIA waived influenza tests. Under current law, pharmacists can do different types of testing. A lot of the CLIA waived are hemoglobin, I can't remember, A1C, I think. And then pharmacists recently also got the authority to do CLIA waived HIV testing. So there are some existing, this would expand upon that. And so the policy question is it appropriate to expand to include CLIA waive tests for respiratory illness as well as for strep throat is the question before you.
Let's see, Song.
I support expanding, and also would like, I don't know if we can probably do this a little later, but I think that we do need to agendize. If we do move forward with this, we need to discuss us also being able to provide treatments for these conditions. So I don't know how we would need to do that, but I think we need to talk about that as well. But yeah, absolutely support this expansion.
So I'm going to stick with you. Anne, were you going to say something? Okay. So I'm going to just stick with you, Song, and kind of just go down to the next group of tests, and that would be sexually transmitted disease, CLIA waive sexually transmitted disease tests, CLIA waive tests that should be considered as part of any pandemic preparedness, as well as CLIA waive tests that should be considered to spread the disease. Are you supportive of those kind of tests too? I mean, do you have any concern about, is there any CLIA waive tests that you would have a concern about including, or should our policy consider not just expanding COVID-19 and influenza, but would we recommend to the full board a policy statement that we would pursue all CLIA waive tests?
No, I think we should pursue all CLIA waive tests, and frankly, that's how I feel. So absolutely, we need to include all the tests, and any tests that may help with the public health, we need to be able to do them. There's just no question about it. So I strongly support.
Okay. Carol, if we're expanding to basically going now items 1 through 5, so it would be all CLIA waive tests. There's someone that there's like a noise in the background. I don't know if you can mute if you're not talking. That might help us. Cheryl, if we look at items 1 through 5, which basically we're trying to say that we would propose to the board, to expand our policy to pursue pharmacist authority to include all CLIA waive tests. Are you in support of that?
Yes, I'm certainly in support, and of course, my only concern is, pharmacists being able to do all this extra work with proper help. I know that's not part of this, but I have to make that comment.
Got it. Jig, are you in support of all expanding the authority for the pharmacist to be able to do all CLIA waive tests?
Absolutely, yes.
Jason?
Yes, I just want clarification that the pathway to expand this authority would be seeking legislation, correct?
That's correct.
Okay.
Thank you.
Then I will abstain throughout agenda item 9.
Okay. Yes, I thank you for your clarification. This would require statutory change. Albert?
Yeah, I feel the same way like Cheryl. I'm strongly supported as long as there's enough help to provided to perform those services.
Okay. Is there any other, so then looking at items 6 and 7, are there any other tests that might require specimen collection that you would like to include in this expanded authority that we'd be giving to the pharmacist? So this would be similar to, and Anne, you can correct me if I'm wrong, but I think this would be similar to what we're currently allowing pharmacists to collect nasal specimens for the COVID test. Is that correct?
Yeah, so it really speaks to specimen collection beyond the CLIA waived, and I think in this scenario, it would be the pharmacist performing the specimen collection and then sending the specimen to a laboratory. These are typically higher complexity tests that are generally done in laboratories.
Albert, would you be in support of those of the pharmacists, expanding the pharmacist authority to include specimen collection? Certain
Yes,
types of specimen collection?
yes.
Okay, so Jason, since this requires statutory, I'm going to skip over you, correct?
Correct. Thank you, Debbie.
Okay. Jig Patel, would you be in support of including in the pharmacist authority to be able to do certain types of specimen collection?
Absolutely, I agree with both 6 and 7.
And Albert, I'm going to come back to you. Is there any specimen collection? I mean, I don't know how we limit this or if that's maybe part of a future discussion, but just off the top of your head and your experience, is there any type of specimen collection that we would, when we say limited by certain types, is there any type of specimen collection that you envision we should limit the pharmacist to?
I do not have any idea. No, I do not have it.
Okay. Jig, do you have any thoughts?
In regards to what again, Debbie?
Are there certain types of, would we open it up to all specimen collection or would we limit it to certain types of specimen collections?
You know, I would want to open it up for all specimen collection. Obviously, when it does go through all the detailed discussion, there will be concerns about where the specimens are collected. There would be some requirements around, safe place, having the PPEs and all of those things, right? So obviously, and with that, with those requirements will come some hurdles where not every single facility might be able to do it, but yeah, I
Okay.
believe that they should be allowed for every single specimen that's out there.
Okay, so Cheryl, this kind of has morphed into really two questions. Number one, are you in support of 6 and 7 of pharmacist authority to include certain types of specimen collection? And if yes, are there any specific type you would want to limit pharmacists to be able to collect?
I'm in support. I'm kind of also thinking about what Jake Patel just mentioned, and I would be concerned about the comments that we will get, in so much as if others have some problem with that. But just off the top, right now, I would be in support of that.
Okay. Song-O?
No, I
Same
think that
question as I gave to Cheryl, kind of that two-part question.
No, like I mean, I think that we should be able to do as many as possible, but like for me, obviously, we don't want pharmacists to be doing like what a phlebotomist would do, like to collect the
Yeah.
blood and stuff. But I mean, I'm sure that's that's something that we're gonna process through as we discuss further. But like obvious common sense areas, nasal, and as wide as we can. I think we should make it kind of broader, as broad as we can.
And I'd like your thoughts on Song's point earlier that it's great if we can do these CLIA wave tests, but I think part 2 of obtaining doing CLIA wave tests is now you have test results, and can we include that as part of our policy considerations and recommendation to the board that we move forward with statutory authority for the pharmacist to not only authority to not only be expanded to include CLIA waive tests, but also to be able to enact treatment based on the test results? Do we need to, I mean, are we already covered, or is that something we need to include in it? Or I'm just interested in your thoughts and direction.
Yeah, my initial thought is that we probably did not write the agenda item broad enough to also go to the prescribing and dispensing based on the test results. I think that's probably a different scope, but it may be appropriate to ask Eileen her thoughts.
Yeah, this is Eileen. I would agree based on the way the agenda item was done. But of course, once we go to the legislature with the statutory proposal, they can always decide to expand out something. But if you want to have a board policy about that, I think we need to have a separate agenda item and discussion.
Okay. So we can't even make it part of our recommendation to the board?
I wouldn't, because we didn't have it on the agenda for other interested parties to be able to make a comment on that.
Okay.
Eileen, I think that they could say that as part of the recommendation that they intend to schedule a future meeting to discuss the next steps following.
That's absolutely correct, Anne.
Yeah, because then you're kind of conveying, Debbie, to the full board where you're going to go next, right? So I do think you can go that far. You just can't develop what that would look like.
Okay. So, I mean, in general, there seems to be consensus amongst all of us that, because I would agree with the statements that have been made so far. And so is there anybody that would like to entertain a motion or put forth a motion recommending the expansion of the policy and statutory changes needed, as well as, include that, the next step or a future meeting, we would also be addressing, what the next steps are, such as prescribing authority?
This is how I can make a motion exactly as you stated, Debbie.
Okay, and do I have a second?
Nah. This Jig.
Okay, Jig seconds. Eileen, is there any way that you think we should reformat that motion to make it, we're going to recommend to the full board? Is there any way we should?
I don't think so. At this point, we don't have any statutory language at this point, but it's trying to get the board's thing. If you wanted to, based on what the board is, and maybe it's adding a delegation to the executive officer working possibly with you, Chair Veal, to develop statutory language.
Okay.
Eileen, so I'm sorry, Debbie, that I jumped in. I apologize. This is Anne. Eileen, would it be possible to include in part of the motion that the recommendation to the full board is that the executive officer and chair work with the current sponsor, or the current author of the board's proposal to see if there's opportunities to engage, and expand the current proposal?
Yeah, I think that's appropriate. That's already pending in the legislature.
Okay, so we'll take that modification. Do you agree, Song?
Sounds good to me, yeah.
And Jig, you're okay? With the modification, the proposal in the motion?
Yes, I'm okay with the modification.
Okay. Okay, moderator, could you please open the phone lines so that we can see if there's any comment from the public?
Thank you, Madam Chairperson. I have opened up the Q&A panel. If any member of the public would like to comment on this agenda item, please type "I would like to make a comment" using the field in the lower right-hand corner of your screen and submit it to all panelists. We are displaying instructions for your reference. And I see that our first member of the public that would like to comment is Lindsay Gulahorn. So Lindsay, I'll let you know when you've been unmuted. And just a reminder, you'll have 2 minutes and I'll give you a 10-second warning. Lindsay, you've been unmuted.
Thank you. Good afternoon, Chairwoman Veal and licensing committee members. This is Lindsay Gulahorn with the California Retailers Association and the National Association of Chain Drugstores. And we do strongly support allowing pharmacists to perform all CLIA waived tests. We currently support the board-sponsored Bill SB 409 to allow pharmacists to perform CLIA waived flu and COVID tests, and we do think that that authority should be expanded further to include all CLIA waived tests. In response to the questions raised in the meeting materials related to this item, generally speaking, our answer to all of those questions is yes. We think pharmacist authority should be expanded to include all CLIA waive tests for all respiratory illnesses, as well as strep throat and CLIA waive tests for STDs. And we believe this expansion should include specimen collection. It is our position that pharmacists should be able to conduct any test currently classified as waived by the FDA. We also agree with board member O that pharmacists should be able to initiate treatment, but we understand that that is not being discussed at this time. Thank you.
Thank you,
you.
Lindsay.
Our next request for public comment is from Lorianne D. Martini. Lorianne, you have been unmuted.
Thank you so much. Lorianne D. Martini with the California Society of Health System Pharmacists, CEO. On behalf of CSHP, we are strongly in support of pharmacists being able to perform all CLIA waive tests. By definition, these are tests that have a minimal risk of harm to patients, and it's an opportunity for pharmacists to more fully engage in public health, as we have seen during the pandemic. And we also support the next portion of the evolution of this discussion item to be able to test and also treat. Thank you for the opportunity to provide comment.
Thank you.
All right, our next request for public comment is from Daniel Robinson. Daniel, I'll let you know when you've been unmuted. All right, Daniel, you've been unmuted.
Thank you. Dan Robinson, Dean of the College of Pharmacy at Western University of Health Sciences. There's another approach to this entire subject, and it's under Business Professions Code 1206.5, and it really it lists healthcare providers who are authorized to provide CLIA waive tests, and is essentially it doesn't restrict. You don't have to define what tests you're talking about in particular. If the results of the test can lawfully be utilized within his or her practice. So if pharmacists, if licensed pharmacists were just added to the list of healthcare providers who can provide CLIA waive tests, then we wouldn't have to be nearly so specific. And even if we didn't use that avenue, and that's actually in 1206.5A sub 2, but if you went down to sub 13, it also says, or other healthcare personnel providing direct patient care. So pharmacists would fall under that category as well. So I'm totally in support of what this bill is trying to accomplish, but I think there's really an easier way to go about it. But thank you.
All right, the next request for public comment is...
Moderator, can I interrupt just for a second? Ms. Snyder, do you have any comments on what Dean Robinson just stated? And Ms. Smiley, you might be on mute.
I'm sorry, Debbie, your question broke up.
I said, do you have any comments on Dean Robinson is indicating that there might be a different way to handle this versus statutory, or maybe it's statutory, but just adding pharmacists?
It is still statutory, and I know what he is saying, but unfortunately the way the Business and Professions Code has not been going about healthcare providers. But I think based on the motion that you have pending, including the executive officer and you possibly engaging the sponsor, if the board so agrees, we can look at all the different statutory options at that point. I think some of the discussion points were broken out because you didn't know where the committee would go, you know, with respect to specific tests.
Okay.
Debbie, this is Ann. If I may say, now that we're broadening it, I think the implementation strategy can definitely, we can take it through a different lens So I appreciate the comments from Dean Robinson, and I think that that's one avenue that you and I can explore, given that we've expanded, how we're approaching this issue.
Okay, thank you. Okay, Ms. Moderator.
All right, the next request for public comment is from Jim Scott. And Jim, you've been unmuted.
Great. Hello, everybody. My name is Jim Scott. I'm Associate Dean at Western U and President-elect at CSHP. I'm speaking in favor of this by whatever pathway it needs to get approved. AB 1328 went through one of the committees yesterday and passed, and it's doing essentially the same thing. So it might be worthwhile to take a look at that. I would also say to look into making sure that these tests can be performed not just as part of drug therapy, but as for screening. There's a lot of health fairs that go on out in the world with pharmacy students and pharmacists, and being able to expand these to make it legal to do some of that screening in there, to then refer to a diagnostician would be very helpful. And I had one other point and it left me already, so I'll just leave it at that. Thank you.
Thank you.
All right, and the last request for public comment is actually wanting to comment on a previous agenda item on the FERPA conversation. So I don't know if you want to let this person speak or if they need to just reach out to the board later.
I think just at this point, I want to keep it focused on this agenda item.
All right, then that is the end of requests for public comment. Shall I close the Q&A panel?
Yes, please.
Okay, it's closed.
Okay, board members, we have a motion and a second. We've received public comment. Based on public comment, I'm just going to open it up. Does anyone want to change anything that we have, anything to our motion? Okay, hearing nothing, I am going to proceed to the vote. Song O, how do you vote?
Yes.
Cheryl Butler, how do you vote?
Yes.
Jake Patel, how do you vote?
Yes.
Jason Weiss, I'll let you state abstain, correct?
I abstain, Chairperson Veal. Thank you.
Albert Wong, how do you vote?
Yes. Yes.
And this is Debbie Veal, and I will vote yes. So a motion passes. Okay.
This is the
Yes.
moderator. I'm sorry to interrupt, Madam Chair, but my co-moderator says that I missed some comments. If you don't mind, I want to open up the Q&A just for this particular agenda item and make sure and that I didn't miss any, and I certainly did, so I apologize.
Okay.
So we have Danny Martinez that would like to comment. Danny, you've been unmuted.
Thank you. Danny Martinez from the California Pharmacists Association. Just wanted to add our name to the list of supporters for this motion. Thank you.
Thanks, Danny.
All right, and then we have Stephen Gray. Stephen Gray, you've been unmuted.
Thank you. Stephen Gray speaking on behalf of CSHP and also myself. I want to reemphasize that CSHP has already introduced a bill that will do what has just been discussed and voted upon. It's AB 1328. And I would encourage the executive officer and the chair to work with CSHP and its author and to perhaps combine the bills and get mutual support. I would also ask that NACDS, CPHA, CRA also take a look at 1328, AB 1328, and support that bill along with the schools. And then finally, this is completely in line with what Dan Robinson said, because the board's bill, which is AB 1533 that was just published, has a section in it that says that by July 1, 2023, the board will move to a standard of care model for pharmacist practice regulation, which means it's really opening it up for pharmacists to be able to do what they're
education, training, experience, and ability allows them to do. And in response to Board Member Butler, this will be a wonderful opportunity for jobs and for expansion of pharmacist opportunities to serve the public, because as Dr. Scott said, all these screenings will help the public screen for diseases, catch things early on, and reduce suffering, reduce mortality, and reduce the cost of healthcare. So we strongly support where the board is going on this, and thank you very much.
All right, the next request for public comment is from Ashim Malhotra. Ashim, you've been unmuted.
Thank you. I just wanted to add my voice to the general forum in support of this motion. I think at California North State University, we've been waiting for something like this to occur, and I'm very glad and proud that the board is considering this. I do want to echo what was said by some of the presenters right before me. I do agree with the dean from Western University. I feel that some of this may be, maybe included in a different way, but I'm just glad that there is movement in this. Thank you for the opportunity to speak.
Thank you. Next request is from Paige Talley. Paige, I'll let you know when you've been unmuted. All right, Paige, you've been unmuted.
Okay, thank you, moderator. I have a comment and a question. My comment is that representing the California Council for the Advancement of Pharmacy, we're in strong support of your motion. And two, my question is, and it won't affect your vote at all, but because the federal government does not recognize pharmacists as providers, would that mean that Medi-Cal and Medicare patients could not have their, that the pharmacist could not conduct CLIA waive tests on them? And I'm not sure.
Anne, I'm not sure that we have that expertise. Do you know?
Yeah, so I guess I'm making some assumptions here, and I think that it probably would depend on the implementation strategy that the board uses and how we move forward. So I think that I can't really respond because it will probably depend on how we choose to effectuate the change. But what I'll say is that I think we've heard the comment, and I think that the board, the committee's recommendation is to make this accessible to everybody. So if there's a implementation strategy that would impede that, I would suspect that that would not be our chosen course, because that would undermine the overall policy goal.
Thank you, Anne. Okay, Paige?
I'm muted. Yes,
okay.
Thank you. Thank you.
All right. And so we have, this is the moderator, we have a list of people that have already spoken on this, I suspect because they thought they were going to be forgotten. But if you'd like, I can go through them one more time just to make sure.
Well, yeah, so I'm looking at the comments. It looks like there's Steve Gray and Danny Martinez, and we have heard from both of them. And so normally let people come back. So I think we're fine.
We're fine? Okay, then I will close the Q&A. Yeah.
Thank you, Ms. Moderator.
You're welcome.
Ms. Smiley, since we have already voted and I don't believe, that any of the comments are mainly in support, or they were all in support. Do I need to re-poll the board members to see if there's any change, or can we just move on?
I think what I would ask is if, based on the comments of support, other than the one question that Paige Talley had, an important one in the implementation, is there any board member that would change their vote? And
okay. Board members, you heard the advice of council. Are there any board members who would change their vote based on the comments received after the vote was taken? Okay, hearing none, I'm going to take that as no. None of the board members would have changed their vote.
And the vote stands as recorded.
And the vote stands as recorded. Thank you. Okay, I am moving on to agenda item 10. which is discussion and consideration of the draft of the pharmacist workforce survey. As a reminder, the workforce survey is being done as the board's response to our sunset report. In the report was an issue concern of medication errors, which needed to be addressed to make sure that we're improving the public health. As discussed, it warrants a study or a survey in order to address medication errors, to make sure that pharmacists understand, and we understand if any of the working conditions could be a contributing factor, and if so, which conditions would cause the problem. During our January 2021 meeting, we discussed an initial draft of the survey, and after that, we decided that updates would be made to the survey to incorporate some of the recommendations made during that meeting. Also, that the draft survey would be reviewed by DCA staff, including a PhD with expertise in survey design. I'm assuming that everyone has had a chance to look at the survey, and I want to note that the staff has confirmed that individuals will be limited to one response per device. We have reinforced the board's preference that pharmacists limit their response to a single submission as well. Before opening up to the public, once again, put together 4 questions to make sure to kind of address the questions in the survey. Once again, kind of grouping them together to make sure that we address the concerns and thoughts that were put forth by the board committee members, at our last call. So understand that everyone has had a chance to look at the survey. I just want to go through these agenda items and see if there's anything we need to change. So first off, one of the things that we wanted to make sure of was that the survey adequately identified the practice site of the responder. That was questions 1 through 10. So as you look at that, do you think we did, the right questions were asked? Number 2, have we identified the types of medication errors and the possible contributing factors? And when you look at the survey, that's basically questions 11 through 27. We are trying to keep it concise. That was one of the things that came out. We still ended up with quite a few, with 20-some questions. But I think in reviewing it, I'm not sure I'm comfortable dropping any of them, but open to your thoughts. And did we miss any key questions? We think we got everything covered from our last call, but please let us know if we didn't. And then, of course, were there any questions specifically that you think we should reword? So I'm going to go through the board members, and I'm going to start real quick with Jason, because I know you're going to drop in any second, to see if there was anything that you wanted to add before you drop for however long.
No, thank you for the opportunity, Chair Gill, and you are correct. I have to step off now. I will let you know when I do return.
Okay, thank you. Let's see, Albert Wong.
I don't have any for now.
Okay. Jig Patel.
No comments.
Okay. So you're happy. Both of you guys sounds like right now you're happy with the survey that we have presented.
That's correct.
Okay. Cheryl, do you have any comments on the current survey?
No, I actually like it. I like the updated survey. Thank you.
Wow, I'm feeling validated here, Anne. And then Song.
Sorry, Debbie, I have one question. I just want to ask, maybe I'm just overthinking here, but for number 6, the question, as a designated pharmacist in charge, do you feel you have enough sufficient autonomy and power to fulfill the necessary requirements? And then the comment, it's if yes, please specify. I feel like it should be if no, please specify, but I could be overthinking.
I think
Debbie,
if
I
yes,
may.
that would, yeah, let me just, if yes, that means, okay, that you have sufficient autonomy and power to fulfill. If no, okay. Yes, Anne, what are your thoughts?
I'm wondering if we just leave it as a yes and a no, and then an opportunity to provide additional comment.
Yeah, that's probably much better, and I agree.
Yeah, I agree.
I
Okay,
agree also.
great. All right, so do we have a motion to recommend to the full board to use this workforce survey?
And that motion would also include the changes to question 6, correct? To remove yes or no and just add comment?
Yes, it would. Thank you.
I would
Anyone
move,
like to make a motion?
I would like to make the motion to move.
I can second it.
Okay, that was Cheryl made the motion and Song, did you second?
Yes.
Okay. Okay, with those comments, moderator, would you please open up the line for public comment?
Thank you, Madam Chairperson. The question and answer panel is now available. If anyone would like to make a comment, please type "I would like to make a comment" and submit it to all panelists using the field in the lower right-hand corner of your screen. And we are displaying instructions for your reference. And our first request for public comment is from Lindsay. So Lindsay, I will let you know when you've been unmuted. All right, Lindsay, you've been unmuted.
Thank you, appreciate it. Hi again, this is Lindsay Golohorn with CRA and NACDS, and we definitely appreciate the board's goal to address and mitigate medication errors with this survey. We've reviewed it and we just want to raise a few things. First, some of the questions seem pretty broad and might result in responses that don't provide the board with the level of information you need. For example, the term error, maybe that should be drilled down a little bit further to specify what qualifies as an error. Is it an error if it reaches the patient's hands and isn't caught at a different point in the workflow, for example? Another example, question 6, the survey asks if a designated pharmacist in charge feels they have sufficient autonomy and power to fulfill their necessary requirements. Sufficient autonomy could be open to interpretation, so we think that maybe should be further defined, or the question should be modified. For example, it could read, quote, "As the designated PIC, do you feel you are able to fulfill the necessary requirements," end quote. Another thing we just want to note and suggest that the board keep in mind is the fact that the answers to this survey won't be representative of a non-pandemic environment. For example, question 17 asks the respondent to indicate the average number of vaccines administered during a typical shift. The responses the board will receive might be skewed given the necessary ramp up we've had in COVID-19 vaccines at pharmacies during the pandemic. Just another thing that we noted, the mission of the board is to protect California patients, and some of these questions don't seem relevant to that mission and seem to address employment practices rather than patient safety. Question 11 relating to the number of staff working during any given shift. Question 20 related to workload metrics. Metrics can help protect patients and can be helpful for pharmacy employers to evaluate the health and needs of their business. For example, determining if they need to hire more pharmacy employees. And finally, the questions appear to be aimed at retail pharmacy practice. If the board wants a more comprehensive understanding of pharmacy practice, the committee might consider adding questions to address other types of practice settings. But I think that's it. Thanks for the opportunity to provide feedback and for putting this together. And we're here to work with you and answer any questions. Thank you.
Yeah, I have a couple questions. So first off, you mentioned errors, and I was thinking question 20 addressed, let's stop. I'm sorry, 24. Question 24, we kind of use that to help understand what people consider are errors. Are you saying in 24 that perhaps there's other scenario or boxes that we should offer?
Yeah, thanks for that question. I think I think 24 is okay. I don't know if it needs to be another question or further defined in one of the questions. Just what is an error? I mean, I understand you're listing incorrect drug, incorrect strength, and that makes sense. But when is it? I guess our question is, when is it considered an error? Is it an error if it gets to the patient? Is it an error when a consultation is being done and the pharmacist realizes, oh, there's something wrong here, and corrects it before it makes it to the patient? That's kind of what we're getting at.
I got you. Okay, that's a good point.
Debbie?
Yes.
This,
Yes, Albert.
yeah. Can we add anything or maybe add on to 28 that ask them if they have any recommendation to improve medication error?
C28 says, please provide any additional information you believe is important for the board to understand about your work site that could impact patient care or medication errors.
And my question is that do they have any recommendation?
Recommendation about how to
improve the or improve or eliminate not eliminate to improve preventing medication error.
Okay.
Maybe they know something that we don't know.
Okay. And then actually going back to the other question that Lindsay had, I believe this was directed at community pharmacy. Is that correct, Ann? I think we talked about this last time.
Yes, it is directed at community pharmacy, and that we do have that in the opening statement.
Okay. Okay, moderator, Ms. Moderator, we have any other comments?
Yes, we do. So our next request for public comment is from Stephen Gray. And Stephen, I'll let you know when you're unmuted. All right, Stephen, you've been unmuted.
Thank you very much for the opportunity to review the survey. These are very important steps and documents. First of all, in question number 4, it says, which of the following describes your practice setting? And then there's a drop-down box, but we weren't able to see what drops down. However, we agree that it is a community-based pharmacy survey. Could you tell us what's dropped down? And then I'll go on to my next comment while you're thinking about that. I agree with the comments from CRA and NACDS that the question is not clear about the error. You first referred to in question number 23, the board's quality assurance requirements, which only bring up an error when it has left the ability of the pharmacy to retrieve it. In other words, as she said, if you catch it while doing consultation and correct it, it's not an error. So that sets up the thinking for number 24. But you probably need to reword number 24 to reflect if that's what you really want. So otherwise, you're going to get what are referred to as errors that near misses and so forth. And those are my comments. Thank you.
Thank you.
All right, the next request for public comment is from Lorianne DeMartini. Lorianne, I'll let you know when you've been unmuted. And Lorianne, you've been unmuted.
Hello, Lorianne DeMartini, CEO of the California Society of Health System Pharmacists. As to the question regarding medication error, there is currently a definition of a medication error in statute in Health and Safety Code 1339.63. It's been in code since about 2006. It is applicable to hospitals, healthcare facilities, but it is something that the board may wish to consider. And it's defined as a medication-related error means any preventable medication-related event that adversely affects a patient in the facility listed in subdivision A that is related to, and it goes beyond what is currently defined as a med error in your questionnaire, but it says that is related to professional practice or healthcare products, procedures and systems, including but not limited to prescribing, prescription order communication, product labeling, packaging and nomenclature, compounding, dispensing, distribution, administration, education, monitoring, and use. And hospitals are very familiar with this. It's collectively referred to as MERP, which is Medication Error Reduction Program. Thank you.
Thank you.
And we have a request for a comment from Paige Tolley. Paige, I'll let you know when you've been unmuted. All right, Paige, you've been unmuted.
Okay, thank you. Paige Talley with the California Council for the Advancement of Pharmacy. I have a clarification question. When you say community pharmacy, it's my understanding, unless licensing has changed, there are only 2 licenses for pharmacies. One's community and one is hospital. So community covers long-term care, all closed-door pharmacies, along with your corner drugstores and independent pharmacies, chain pharmacies, and all that. So who does this workforce study apply to?
Anne, do you want to respond to that?
Yeah, so it would be all of the community settings, but I believe that the drop downs will then drill down to help them identify. I apologize, I do not have the list of all of them, but can have that available for the board during its meeting next week.
Debbie,
Yes.
why we only limit to community pharmacy? Why we not include all pharmacy?
I think the and Anne, you can correct me, but I think that was the focus from the comments on the sunset report. Is that correct, Anne?
Yes, that's correct.
All right, this is Moderator. I have no more requests for public comment. Would you like me to close the Q&A panel?
Yes, Ms. Moderator, thank you.
You're welcome.
Okay, so there was a couple comments about question 23. I'm just going to it real quick here. So 23 says, in your opinion, are medication errors appropriately documented and evaluated consistent with the board's quality assurance requirements at your pharmacy, primary work site? And I do think there's at least 2, if not 3 comments around that we probably need to define what medication errors are, at least per our statute. And I don't think, let's see, in our preamble, our introduction, it says the #1 violation resulting in citation nearly every year is the last review cycle for community pharmacies is medication error. Medication errors include the following: incorrect drug, incorrect strength, incorrect directions, prescriber quantity, patient and or patient receiving prescription for another patient. So I don't know if we do it in this dear valued stakeholder at the beginning, or we do it as part of that question, but perhaps I think as was pointed out, that maybe we need to point out that this is going to go that the law that we had there, that it's errors that actually impact the patient. I think. I don't know what.
Debbie, should it be helpful to look at the regulation section 1711 that speaks to quality assurance programs? Yeah. Where it in B, it talks about, for purposes of this section, medication error means any variation from a prescription or drug not authorized by the prescriber as described in section 1716. Medication error as defined in this section does not include Any variation that is corrected prior to furnishing the drug to the patient or patient's agent, or any variations allowed by law.
Thank you. So do we need to try to work that into, it seems like the easiest place to work it into is the opening statement. You know, where we even say medication errors include blah, 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 blah. And so maybe we just have a second sentence that says something like, you know, medication errors are not what, you know, basically what Ann just said out of the statute.
I think that's a great idea, Debbie. And also for question 24, maybe we should also have an other box on there. Sorry to add things.
No, it's totally good.
I like that idea of other box because there are other things that pharmacists are doing now besides filling prescriptions.
And then the other thing is Albert suggested maybe we have a number 29 that includes recommendations about how to improve.
Or we just say reduce medicine error.
How to reduce medication errors.
Yeah. Yes.
So my only question with that, and you have me about halfway there, but this is my question. The purpose of the survey is to identify things that cause errors. I'm not sure adding one more question is going to make anybody not take the survey, but I just want to make sure that if we capture that piece of information, is that aligned with the purpose of the survey? I don't know, you know, if others have thoughts on that. I'm kind of on the fence, so. Any other thoughts?
It doesn't hurt. It doesn't hurt to have those information.
Okay. Okay, Cheryl, you made the motion. Do you want to revise your motion to include some of these changes that we, you know, I guess one would be to add a sentence in the preamble, the welcome letter, whatever you call the first part, to clarify what that the medication error is only if it gets to the patient, consistent with the language that Ann had. Then add another, we already changed 6 in our motion, so that's already done. To add another box to 24, was it? To 24 that says other, so people could fill that in. And then to add 29 to be a box, and it would say something to the effect of, please provide any recommendations you have which help reduce medication errors. So those are kind of the 3 comments we had. Would you like to amend your motion to include those changes?
Yes, absolutely. I don't see where we lose anything here. I think we're just gaining more information.
Albert, oh no, I'm sorry, Song, you had seconded it. Are you in agreement with the
Absolutely. Yes.
Okay. So Eileen, we're making changes based on comments. Do we need to reopen it for public comment?
I think the only comment we didn't address was some of the drop downs, but we're going to have that at the board meeting. I would just open it up for public comment again, just in case somebody had a different one that we didn't incorporate.
Okay.
But just stress if people could limit their comments to this motion, not the same concerns they had before.
Okay. Then hearing that, we have a motion. We have a second. I'm going to take roll call for voting. Stone Ong, how do you vote? Cheryl Butler, how do you vote?
Yes.
Jig Patel, how do you vote?
Yes.
Jason is gone. Albert Wong, how do you vote?
Yes.
And this is Debbie Veal. I will vote yes also. So unanimous. Okay, I'm going to move on to agenda item 11. Discussion and consideration for approval changes to the proposed. Somebody needs to mute themselves again.
Hi, this is Eileen. I just wanted to make sure that the record reflect that Jason Weiss was still not back at the meeting, and that's why he wasn't called on.
Okay, thank you. Okay, agenda item 11 is discussion and consideration for approval changes to the proposed board-provided training pursuant to BPNC sections 4052.02B, 4052B3, related to the HIV pre-exposure or PrEP and post-exposure or PEP prophylaxis. So in the media material was all the background. We've spent a lot of time in the past talking about this legislation and the relevant laws that it applies to. In September of 2020, the board approved a draft training program. However, subsequent to approval, the staff was notified that the subject matter expert identified to complete the recording of the training was no longer available. So a new expert, Dr. Betty Dong, has volunteered to assist the board with finalizing the training. Dr. Dong's credentials and CV are included in the meeting materials. For our review today is an updated presentation prepared by Dr. Dong. There do not appear to be any significant changes to the training program. The learning objectives and content areas remain the same, and based upon my review, the changes made included updated data and resources to reflect the most current information, as well as some reorganization of the materials and inclusion of some additional graphics. The board staff is recommending approval of the updated training program. And so members, I would appreciate hearing from you any comments you have on this updated program. And should you believe it appropriate, I would entertain a motion to recommend approval to the board of the updated training program. Okay, I'm going to mix it up. Jig, I'm going to start with you today, right now.
I'm okay with that.
Okay. Would you like to make a motion?
Sure. I would like to just read it as is.
Yeah, entertain a motion to recommend to the full board approval of the updated training program. Okay.
Yep. Yes.
This is Song. I can second it.
Okay, Song, thank you. Cheryl, do you have any comments?
No, I read through the whole thing and I like it. It's fine. I support it.
Song, I'm thinking since you just did the second that you're okay. Do you have any comment?
Oh, yeah, I'm okay. The only thing is that I'm curious. This is obviously an issue that evolves very fast, and there's new guidelines and updates. Do we need to do this every time something changes in the recommendations?
Anne, can you answer that? I was thinking that as far as the legislation, we can make changes can occur, but as far as the training program, can you comment?
So I would, yes, as the practice evolves, probably the training will need to evolve as well. At this point, the board has not delegated to staff to work with experts. At this point, it's all being done at the board level. And in the future, it may be appropriate for the board to consider, delegating that, but it's not agendized today. So I would encourage, us maybe to not fully contemplate that, but I do think that that's an option moving forward.
Thank you, Song, for your comment. Albert?
I got no comment.
Okay, let's, moderator, could you please open the phone lines for comments from the public?
Thank you, Madam Chairperson. The question and answer panel is now available. If anyone would like to make a comment, please type "I would like to make a comment" using the field in the lower right-hand corner of your screen and submit it to all panelists. We are displaying instructions for your reference. Our first request for public comment is from Jim Scott. Jim, I'll let you know when you've been unmuted, and you will have 2 minutes with a 10-second warning. Jim, you've been unmuted.
Hi, it's Jim Scott again, Associate Dean at Western U and President-elect at CSHP. I also have a background in treating HIV, so I'm speaking in support of approval of this program. I helped put together CSHP's program. We've currently had about 350 pharmacists take that training program. I've known Betty Dong for quite a number of years, and I work with her in a couple of different areas. She's very well respected in her field, and she often speaks on various aspects of HIV treatment and prevention. So I recommend that this program be approved. Thank you.
Thank you.
All right, this is the moderator. I see no further requests for public comment. Would you like me to go ahead and close the Q&A panel?
Yes, please.
Okay, it's closed.
Okay, board members, we have a motion with a second, and we've heard public comment. I am going to now call for the vote. Song, how do you vote?
I support.
Cheryl, how do you vote?
I support.
Jig, how do you vote?
I support.
Albert Wong, how do you support? How do you?
Yes.
Sorry, how do you vote?
Yes.
Okay.
Yes.
This is Debbie Veal. I vote yes. Jason Weiss is not available for a vote, so that's why I did not call on him. And as such, of the members currently present, it was voted unanimously. Okay, I am moving on to agenda item 12. We are at the end here, guys. So hopefully everyone has had a chance to look at the licensing statistics that are in our material. As of March 31st, the board has received 10,166 initial applications and received 389 requests for temporary license application. We've issued 6,148 individual licenses and 303 temporary licenses and 372 permanent site licenses. Processing times are also included in the meeting material, and based on my review, it appears that the processing times for applications, with one exception, are now at or below the 30-day time period. So thank you to Anne and her staff. I know that there have been delays in the processing of deficiency mail for several of our site licensing program, and we look forward to seeing improvement in this area by the next committee meeting. With that, are there any comments from board members on the licensing statistics or questions? Hearing none, Ms. Moderator, would you please open the lines for public comment?
Thank you, Madam Chairperson. I've opened up the Q&A panel. If anyone would like to make a comment, please type "I would like to make a comment" and send it to all panelists using the field in the lower right-hand corner of the screen. We are displaying instructions.
I don't know, Ms. Moderator, I'm not hearing any, I'm not seeing any.
I am not either. Shall I close the Q&A panel?
Yes, Debbie, I have a comment.
Yes, sir.
Yeah, I have some licensee calling me regarding some of the licensing processes. Kind of it has a long delay, so I would like to see that we improve in that area. You know, speed up the process a little bit. Thank you.
So thank you, Albert, for that comment. I think we have seen improvement. Now, specifically if it's around site licensing, that is, especially if there's any kind of deficiency that we've had to go back to the applicant on, that's where we have, we acknowledge that we have fallen short and that we hope to have that fixed. So I'm wondering if that's perhaps what you've heard about, site licensing, especially those with any kind of deficiency, which
Well,
happens quite often.
you know, sometimes it seems like takes long time for the board to respond to them. I think it's okay if there's a problem, if something deficiency, but I think we should respond them to see what's missing, what's needed. So improve this responding time. I would like to see that.
Okay, and when we do a deficiency, we are telling them specifically what's missing.
Right.
And then we're waiting for them to respond. But yeah, I think we acknowledge that specifically around deficiencies for site licensing that we are falling short, and that is our goal to get that up to where it's supposed to be. The other ones seem to be in line. But thank you for your comment, and hopefully by our next committee meeting that will be addressed.
Okay, thank you.
So thank you to the members of the public who were here today and participated, and thank you to my fellow board members and committee members for taking time to also be here. Our next committee meeting is currently scheduled for July 14th, with the following one currently being scheduled for October 27th, so make sure you mark your calendars. There was one thing, going back to that last agenda item, I just remembered we wanted to direct the staff on the PEP and PrEP. Anne, can you make sure that we have in a future agenda to discuss providing the executive officer with the ability to review training materials? And so does it have to come back to
Yes,
the
I've made a note
board?
for that as well. I've made a note for that as well as potential future agenda items to treat based on CLIA wave results.
Okay, thank you. Okay, so with that, thank you very much. This meeting is adjourned.
Thank you.
Thank you, everybody. Have a good night.
Okay.
All right, see you
Okay.
guys.